Hello, I'm Maruk Said, your microbiology guide. Let's explore in-depth micro techniques and uncover groundbreaking insight together on this educational journey into the fascinating realms of microbes.
Confounding variables and bias in epidemiology. Understanding their effects on research. Table of contents. Introduction. Bias, confounding, and interaction in epidemiology. What is bias in epidemiology? Types of bias. What is confounding in epidemiology? Effect modification and interaction. Strategies to minimize bias and confounding. Introduction. In an epidemiological study, the relationship observed between exposure and the development of an outcome aims to reflect the true association. However, alternative explanations, such as random error, bias, or confounding, could influence the results. This can lead to incorrect conclusions, such as detecting a statistical association when none exists, or failing to identify one when it does. These issues are particularly common in observational study designs. Therefore, it is crucial to account for these factors during both the design and analysis stages to minimize their impact on the study's findings. Bias, confounding, and interaction in epidemiology. Measurement errors due to bias can arise at various stages of an epidemiological investigation, impacting both the internal and external validity of the results. Research bias, confounding variables, and variable interactions also play a significant role in determining the strength and existence of associations and causality within the study. In this regard, researchers, epidemiologists, and public health professionals must be vigilant in minimizing or eliminating bias to ensure the reliability and accuracy of their findings. If you have watched till here, don't forget to subscribe to Family of Science Lovers. Press the bell icon button so you are always updated. What is bias in epidemiology? In observational epidemiological studies, bias refers to systematic errors in study design, data collection, or analysis that distort the estimated relationship between an exposure and the outcome of interest. This occurs due to consistent variations that introduce errors in measuring associations and interactions. Types of bias. Over 50 types of bias have been identified in epidemiological studies, arising from errors throughout the research process, from the study's inception to the reporting of results. However, the most frequently encountered types of bias in epidemiological studies are outlined below. Selection bias. Selection bias refers to a systematic error that arises during the selection, identification, or screening of the study population based on exposure and health outcomes. This bias compromises the external validity of the study, leading to false conclusions about the research hypothesis. As a result, the findings become irrelevant to other populations and fail to accurately represent the true relationship. This bias occurs when characteristics of individuals included in the study differ from those of the population to which the findings are intended to apply. These characteristics are often linked to the exposure or outcome under investigation. Generally, all forms of selection bias involve a scenario where the relationship between exposure and outcome differs between the participants included in the study and those eligible but not included. Case control studies. Selection bias is a common issue in case control studies, leading to a lack of comparability between cases and controls. Since controls are meant to represent the same population as the cases, errors can arise when the control group does not accurately reflect the population that produced the cases. Cohort studies. In cohort studies, Where the exposed and unexposed groups are selected before the outcome develops, selection bias is less likely. However, it can still occur if there is variation in follow-up or case identification across exposure groups. Randomized trials. In randomized trials, participants are theoretically assigned to groups at random, reducing the likelihood of selection bias. However, withdrawals and refusals can introduce bias if these actions are related to the exposure or outcome under study. Information bias. Information bias, also known as measurement bias, occurs during the data collection phase. It leads to deviations in effect measurements due to inaccuracies in recording or classifying key variables, such as exposure, outcome, or confounders. Misclassification bias. Misclassification bias arises when individuals are incorrectly categorized in terms of their exposure or outcome status. For example, exposed individuals may be misclassified as unexposed, and vice versa, leading to inaccurate sensitivity and specificity in detecting exposure and outcomes. This can result from missing data, random errors in data entry, or other inaccuracies. Misclassification bias can be further classified into different types. Differential misclassification bias. Differential misclassification bias occurs when the misclassification of one variable, exposure or outcome, differs across the groups being compared. In this case, the misclassification of one category, such as exposure, is related to the other category, like the outcome, leading to biased associations. Non-differential misclassification bias. Non-differential misclassification bias arises when the misclassification is consistent across the groups being compared. Here, the misclassification of one category, exposure or outcome, is unrelated to the other, affecting both groups equally, and often results in a dilution of the true association. Detection bias. Detection bias is common in studies with follow-up, such as cohort studies and clinical trials. It occurs when there are inconsistencies in how outcome information is collected or verified across different groups. This can lead to either an overestimation or underestimation of the effect size. For instance, men with larger prostates may have difficulty being accurately diagnosed with prostate cancer via biopsy, potentially underestimating the true association between obesity and prostate cancer risk. Interviewer or observer bias. Interviewer or observer bias arises from various factors within the study, primarily due to inconsistencies in assessing exposure history between cases and controls, or in measuring outcomes between exposed and unexposed groups. Factors such as knowledge of the study hypothesis, the mode of interviewing, unequal emphasis on certain questions, and awareness of exposure or outcome status, including intervention, can all affect data recording. For example, bias may occur when an investigator pays closer attention to a group receiving a new drug treatment compared to a group receiving standard treatment, potentially skewing the results. Recall bias. Recall bias, a type of information bias frequently seen in case control studies, occurs when an individual's recollection is influenced by their disease status or exposure history. It arises when cases and non-cases, or exposed and unexposed groups, recall past events differently. For instance, individuals with a health condition may be more likely to recall past exposures due to heightened concern about their health, while those aware of a particular exposure in a study may be more inclined to report symptoms, either accurately or exaggeratedly. Reporting bias. Reporting bias occurs when participants' responses are influenced by the researcher's expectations, or when sensitive questions about socially undesirable behaviors, stigmatized diseases, or family matters cause participants to alter their answers. This can lead to inaccurate reporting and skew the study's results. If you have watched till here, don't forget to subscribe to Family of Science Lovers. Press the bell icon button so you are always updated. What is confounding in epidemiology? Confounding refers to a distortion in the observed relationship between an exposure and an outcome due to the presence of a third, external variable known as a confounder. This distortion can misrepresent the true association, potentially altering the perceived direction of the effect. There are two types of confounding: positive confounding, where the observed association is skewed away from the null, exaggerating the relationship, and negative confounding, where the association is shifted toward the null, diluting the relationship. Confounding variable. A confounding variable, or confounder, is a factor that is associated with both the dependent variable, disease or outcome, and the independent variable, exposure being studied. This factor affects the risk of disease and distorts the influence of other variables on the outcome under investigation. When a confounder is present, the study may fail to reveal the true association between exposure and outcome, either exaggerating or reducing the actual relationship between them. Factors such as age, gender, lifestyle, socioeconomic status, and ethnicity, which are directly linked to the health outcome, are potential confounders. However, for a factor to be considered a confounder, it must meet the following three criteria. It should not be a factor resulting from the exposure that leads to the disease, meaning it is not part of the causal pathway. It must be associated with both the dependent and independent variables, meaning the confounder may be related to the exposure without causing it, but it must influence the outcome. Its distribution and effect should differ between the groups being compared. For example, in a study hypothesizing that coffee drinkers are more prone to heart disease than non-coffee drinkers, smoking could act as a confounder. Coffee drinkers might smoke more than non-coffee drinkers, and smoking, not coffee consumption, could be the true cause of the heart disease. Thus, smoking distorts the association between coffee drinking and heart disease. Effect modification and interaction. Unlike bias and confounding, effect modification is a biological phenomenon that describes a true causal relationship in which one exposure variable alters the impact of another exposure variable on a specific outcome. When effect modification occurs, different population groups exhibit varying risk estimates. Although the terms effect modification and interaction are sometimes used interchangeably, they represent distinct concepts. Interaction is a statistical phenomenon that arises when the combined effect of a risk factor and a confounder is greater than what would be expected based on their individual effects. This occurs when the presence of a third variable influences the magnitude or direction of the association between two variables. For example, a drug effective for treating viral diseases in adults may be ineffective in children. In this case, the drug's effectiveness is modified by the age of the individual. Analyzing associations at each level of the third variable is an effective method for addressing interaction in studies. Strategies to minimize bias and confounding. The presence of errors and bias can lead to inaccuracies in measuring associations, which is common across all epidemiological studies. However, the impact of these issues on both external and internal validity can render a study either ineffective or usable only with significant caution. To enhance the specificity, reliability, and accuracy of research, various strategies should be employed to minimize bias and confounding. Some methods for reducing bias include developing well-standardized protocols overseen by trained interviewers and researchers, utilizing standardized questionnaires featuring appropriate close-ended questions with specific response options, ensuring consistency in the level of questioning for both comparison groups, verifying collected data by cross-referencing with existing documentation and records, or by evaluating biomarkers, conducting pilot studies to identify and address issues in questionnaires and other measurement tools, estimating the likelihood of misclassification bias to assess its occurrence. Similarly, multiple approaches can be employed to reduce confounding at both the design and data analysis stages of a study. The strategies used during the design phase include randomization. A preferred method in clinical trials, randomization entails the random assignment of participants into groups to achieve an equal distribution of variables, thereby limiting potential confounders. Restriction. This approach limits study participation to individuals who are similar concerning the confounding factor. Matching. Controls are selected to ensure that the presence of potential confounders is comparable to that of the cases, which can be achieved through either pair matching or frequency matching. Methods employed during the analysis phase include stratification. This method involves examining the association between exposure and outcome at various levels of the confounder, such as age or gender. Multivariable analysis. This statistical modeling technique allows for the simultaneous adjustment of multiple confounding variables, followed by the assessment of each confounder's effects. Standardization. This method utilizes a standard reference population to neutralize the effects of confounders across study groups. Thank you so much for watching. Don't forget to subscribe to my channel, press the bell icon button. Thank you!